Ladies and gentlemen, welcome to this debate. I'm Deborah Pacifico, a PhD student at Università della Svizzera italiana in Lugano. It's my pleasure today to introduce you to the motion for debate, which is that mental health interventions are a key priority for refugees and asylum seekers. I strongly believe this is true. During this brief debate, please keep in mind that when we are referring to mental health interventions, we are not only speaking of interventions targeting a particular disorder or disease, but we are referring to a set of interventions helping people coping with new conditions, situations, and circumstances. Refugees are exposed to many different stress factors. Think, for example, about the country that they have to live, where there might be poverty, war, terrorism. These are, technically speaking, pre-migration factors. Now, focus your attention on the journey that they have to face. These figures are more the migration factors. The post-migration factors also play a fundamental role in refugees and asylum seekers' mental health conditions. Among these factors, we find the conditions that refugees and asylum seekers find in the host country. Refugees and asylum seekers are much more likely to the general population to develop a psychiatric disorder, such as the post-traumatic stress disorder. The right mental health interventions may give them the right instrument to react to the trauma and the extreme situation that they are living. This will for sure have a benefit for the person who will address his or her problem in the short term, but we also have a benefit for the society at large, as this person will integrate in the society itself. When we are speaking about refugees, we refer to a varied population, so among them we also find children. After forced migration, children might be shy or might tend to isolate themselves. They don't want to interconnect with others. They may also show higher levels of depression or anxious symptoms. Maladaptations and problems are right behind the corner. So mental health interventions will help children to be integrated in a new society and in a new culture. And once again, the benefit will be for the children themselves, but for society as a whole in the long term. The World Health Organization Constitution, which is a fundamental document when looking at people's health rights, highlights the right of everyone to enjoy the highest attainable standard of physical and mental health. I strongly believe refugees and asylum seekers should benefit from that too.
Ladies and gentlemen, to reiterate, the motion for debate today is that mental health interventions are a priority for refugees and asylum seekers, and I am arguing against this motion. Now, when we say priority, we're not saying that we disagree that mental health interventions are important, but rather that, given limited resources, choices about how to allocate such resources need to be made. And I argue that in such situations, mental health interventions should not be at the top of the list. In his classic 1943 paper, A Theory of Human Motivation, Abraham Maslow described a hierarchy of needs, in which primary physiological needs such as food, water, and warmth come first, and only later psychological needs. So therefore, this links not just to SDGs 3, 8, 10, and 16, as my opponent has described, but also to SDGs 1, no poverty, 2, zero hunger, and 6, clean water and sanitation. Now, we don't know what will happen in the future, and therefore we need to prioritize what is needed today and not what might be needed tomorrow. My second claim is that psychological and mental health care is expensive. Studies have shown that in Switzerland there are over 120,000 refugees and asylum seekers, and a recent study with over 850 professionals found that funding translators and treatment is a major barrier to scaling up services. Now, if a rich country like Switzerland cannot afford to do this, how do we expect those poorer countries that bear the brunt of the refugee and asylum seeker crises globally to prioritize such services? Therefore, more of the budget allocated for addressing refugee and asylum seeker care would need to be put towards this aspect and away from other areas. A final claim is that if we misprioritise, then a key driver of mental health outcomes, i.e. integration into the host society, can be put in jeopardy. Homelessness, dependence on welfare, and epidemics linked to refugees all serve to stigmatise this population, and therefore it is much better to address these issues and help ensure that these people are better integrated into society and therefore to reduce stigma. So in conclusion, I'm not saying that this isn't an important topic. I'm saying that faced with hard choices, tough decisions need to be made. And I hope you agree that there are other priorities, both health and non-health related, that take precedence. Thank you very much.